Good morning, everyone. Good morning to all our followers on our Facebook Live session. We love Nogales, broadcasted from the main conference room at the Mariposa Community Health Center here in Nogales. This is a session we do almost weekly to link Mariposa with our patients, our staff, and our partners. Something we find it very useful. We like to share information with you that we hope keep each other safe. And certainly we love your feedback in terms of questions and other topics that you like for us to address. COVID-19 has been our life, and it should be, for the last few weeks. Mariposa has been very busy managing the cases, clinical management, decision making, testing, working closely with our partners, including the health department. Today, we have a very distinguished guest with us, Representative Daniel Hernandez Jr., represent District 2, member of the legislature since 2017, has been a great supporter of Santa Cruz County and Mariposa, and I want to extend a cordial welcome to you, Representative.
Thanks for having me. I'm excited to be here.
Great, thank you very much. And then all of you know my esteemed colleague, Dr. Phil Williams, head of Pediatrics, who's been just outstanding in managing our COVID-19 strategy over the last few weeks. And essentially we engage in a conversation, we look at patterns, and I think more important, we'd like to share with you what the data says, what the science says, and what we should be doing. As I said before, this is an illness that affects all of us, highly contagious, but we have a strategy. We have a playbook that Representative and Dr. Williams will talk about as we go. We hope to cover a few things today. With Representative, we'll talk about the landscape of the infection in the state. You speak to your colleagues, you travel a lot, we'd like to hear what you have to say. And then we'll move on to what's happening in the country, and then we'll talk about a little bit about masking. I'm going to try to do both, Spanish and English.
Okay.
So buenos días a nuestros seguidores en Facebook Live. Bienvenidos a Mariposa. Estamos transmitiendo desde el salón de conferencias de Mariposa. Mariposa ha estado muy ocupado en el manejo de la enfermedad COVID-19. Hoy tenemos un invitado muy especial, representante de Hernandez Jr., para ayudarnos a cubrir qué está pasando en el estado, investigar un poquito cómo van las cosas en el país, hablar de las consecuencias que existen como resultado de esto, y mi colega el doctor Williams, que ha estado presente anteriormente, nos va a ayudar un poquito a hablar de las máscaras o mascarillas o tapabocas, como le llamemos, para protegernos uno al otro. Sabemos, la estrategia es simple. Los expertos que llevan toda su vida investigando virus respiratorios nos lo han dicho. El doctor Fauci ha sido muy enfático en lo que tenemos que hacer, y la idea es que compartir con ustedes la ciencia que existe. Espero que esto sea de utilidad a nuestros seguidores y vamos a empezar. Representante, un placer.
Muchas gracias por tenerme.
No, un placer como siempre. A nuestros seguidores vamos a hablar inglés y español, vamos a cambiar, así como lo hacemos en Mariposa, ¿verdad?
Sí.
Hacemos inglés y español. Voy a cambiar a inglés y luego a español. So I'm going to switch to English for a moment.
Okay.
And so happy to have you again for that. So we know that there's a surge in cases. We can look at why. Clearly, there's evidence of new infections. We're also doing more testing, so we know that. But what concerns us is the new infections, and they're very concerned about that. I think the state has taken some measures in some ways, but at the end of the day, it's it's about what we can do at the local level, right? I mean, we have you follow your direction, the governors and others. At the end of the day, it's about us. So I'm going to ask, tell us how what's happening in the state level. What do you see? You talk to your colleagues, the House, the Senate, governor's office. What is your take on all of that?
I think what we're seeing right now is a direct correlation to the actions or lack of actions taken by the state. So for context, the state legislature stopped meeting in May. We came back, we finished about 20 bills, and then we sine-died, which meant that we were done for the year. While there is possibility of a special session, there is not actually anything that's been scheduled, and there's not been any confirmation. So what has happened is, because of the executive orders and the emergency powers that the governor has, basically all of the rulemaking, all of the procedures that we're putting into place at the state level are coming directly from the governor. So it's been him and his office who have been really owning putting out guidance and restrictions. What we saw at the beginning was we had the stay-at-home order, which had some holes with it, but it was pretty consistent. If you are not an essential business, even though there were some businesses that I would have disagreed with whether or not they were essential, it said you're going to be closed for the foreseeable future while we try and flatten the curve. What happened is, after May 15th, the expiration of those stay-at-home orders ended, and now what we're seeing, I think, is spikes that are coinciding with when we started seeing people going out for the first time in weeks. So we saw after Memorial Day, 2 to 3 weeks later, a lot of new folks who were displaying symptoms. And now that we have stronger testing in most places, Mariposa and Santa Cruz County are still lagging behind, not for lack of your trying, but because trying to get the resources at first was nearly impossible. We saw supply chain problems with reagents, with the swabs. So we're still working on testing down here, but in some of the places where we have the largest amount of population in the state of Arizona, we saw immediately after we lifted the restrictions, people going to restaurants, to bars, and nightclubs using an exemption that said that if you served food, you could reopen. So we saw people going to nightclubs and partying, not observing social distancing, not using hand sanitizer, not using masks. So what's happening now is 2 to 3 weeks later after that, we're seeing a spike in our infections. And today we saw one of the highest rates we've ever seen. But one of the things that your viewers kind of need to keep in mind is the number of positive tests that we get reported today weren't tests from today. These are tests that, depending on where they got it, which provider, what kind of test, could be 2 to 3 days delayed, or in the worst case scenario, up to 10 days delayed. So there are folks who are getting tested now who may not get the results for 8 or 9 days. And when they find out and the state reports that information, that's when we all learn about it. So the data from today is aggregated from a variety of sources. So I think sometimes it's really confusing to people that on one day we'll have 2,000 cases, the next day we have 3,900. It wasn't that in one day 1,500 new people got infected. It's that the tests were lagging. And I think what's happening right now is we saw the governor yesterday say, stay at home if you're sick. But what we're not seeing is a statewide plan that is actually encouraging people who are in non-essential services or businesses to close back down. So what we're seeing is businesses themselves are having to take it on. And what we're now having to do is really rely on the public and on individuals to not just make decisions for themselves, but for their entire communities. So in the absence of a statewide plan, in the absence of a national plan to contain and reduce the COVID infection rate, we're relying on people and their best judgment to make sure that we are slowing the spread. So right now, I think we're in a really dire situation. Our infection rate today was 22% for all of the tests that are being done for PCR. That's alarming because when we started having this, people said, you know, a normal infection rate for something like this is going to be somewhere in the 8 to 10% range. So if 8 to 10 was what we were expecting, now we're at 22%. There are red alarms going off everywhere. We're seeing that we're still not doing enough contact tracing. We really don't have a system statewide for figuring out how we isolate people, how we contact trace, let alone how do we shut down some of these businesses that right now are putting people in an unnecessary position to put their health and others at risk?
And I think that, thank you for that review. I think that goes along with what we know about this. You mentioned social distancing,
Right.
and we hope we continue saying that in this transmission several more times.
Right.
Masking, and certainly hand washing. You mentioned contact tracing, because we need to follow those people.
Right.
You know, you've been exposed to a confirmed case. We know this is very transmissible.
Right.
It is estimated that one person typically will transmit the virus to 2 or 3,
Right.
typically, maybe more sometimes.
Right.
So I hope the message of this transmission is essentially that. I see some institution, businesses, and others that are sort of going back to be more careful,
Right.
because we've seen cases not just in Phoenix but
Right.
others, other locations where that led to
Right.
a significant number of infections, and this infection is shifting.
Right.
The demographics are shifting.
Mhm.
The younger people are being attacked. Clearly, the older, it's a big problem, but in Arizona, most cases are between age 20 and 44.
Right.
We know the mortality is higher in the older, but that's
Right.
really important.
And I think what we're also seeing that's a little bit alarming is our hospital capacity for the
Yes.
most severe cases is shrinking, not because we don't have great doctors and nurses and hospitals, but because of the steps that we neglected to take. People went back out, weren't wearing masks, weren't observing social distancing, so they were exposed to this virus, and now we're seeing people who are infected with COVID-19 who are showing up with pneumonia and needing to be put on ventilators and respirators. So I think more acutely we need to be cognizant and really careful, because we are on the verge of overwhelming our hospital system across the state. We see Banner, one of the largest healthcare providers for acute care here in the state of Arizona, saying we are having to bring in nurses from other states to help with the overage of patients who we're having to see. We're seeing contingency plans being put into place to reopen hospitals like St. Luke's in Phoenix. We're looking at potentially turning convention centers into hospital spaces again. But this is because we didn't have a state plan that extended after May 15th, and now we're seeing the results. But this is something that's happening all over the country.
Right.
When we look at Texas and Florida, they're in the same boat that Arizona is. They saw huge spikes. I was talking to a friend from Houston who was talking about they are putting up places to have patients in parking lots and tents. But what they lack are the physicians, the nurses, the healthcare providers to actually provide the care. And we don't want Arizona to be in a situation in 2 to 3 weeks where we could have slowed the spread, but instead of doing the responsible steps that you talked about in your playbook, we didn't do that. We ignored those guidelines, and now our hospitals are overwhelmed, and doctors are going to have to make the choice of, okay, who deserves the ventilator more? The man who's in his 40s and is the father of 3, or the grandfather in his 80s? And we don't want to have to put physicians in those positions to make a life and death choice because of lack of an infrastructure and hospital equipment.
And I think that's exactly why we talk about medical resources, and you know, we take care of everyone, but the reality is that medical resources
They're finite.
You're finite. They're limited, and so that's really important. Along the same lines, a couple of observations from recent publications. Texas children began admitting adults because of the large number of cases. In Harris County, they only had about 11 days of ICU beds left. Hospitalizations have gone up in Arizona, California, and Texas. In Arizona, going back to what you said, 88% of the ICU beds were full.
Right. And then if we can just dig into that a little bit deeper, when people are in the ICU, that means that they are the most critical. That doesn't mean that there aren't people who are still in the emergency room or in other hospital rooms that aren't on the verge of needing ICU care. And when folks go into an ICU, it's not they're there for a night and then they go back home. A lot of these folks, especially with the most severe cases, could be there for weeks. So when we have an 88% usage rate of our ICU beds in Arizona, we need to be really concerned because it's not like we're going to turn people over unless one of two things happens. They start dying because they were so severe, or we slow the spread and we're not having people showing up with as severe cases to the hospitals and then needing those ICU beds.
Absolutely. And I think the purpose of all of this, what we're doing today, is precisely that. It's all about prevention. You know, testing is important to isolate, to trace contact. We get all of that. But this is all about prevention. We know what the playbook is, and we'll talk about that as well. And that's a good summary. Just a couple other observations. 3 states have now ordered quarantines to travelers coming from other states. That includes us, the state of Arizona. So if we go to New York, you have to be in quarantine for 2 weeks.
2 weeks.
That's interesting. And I think Disney has canceled their reopening as well. So, and MGM Resorts have said that if you're not wearing a mask in the property, you'll be asked to leave. That's in Las Vegas. So I think going back to what you said, I think businesses are reconsidering their strategy because they understand that large gatherings promote the transmission.
Right. And what we're seeing, I think, is it's a moving target because as we take our foot off the gas pedal on prevention, we see spikes in infections. So as we lessen what we're doing to reduce the spread, it sets back us being able to reopen Disneyland. It sets us back being able to reopen schools. And I think this is one of the things where we're not trying to fearmonger. We're trying to inform the public so that they can make the best choices for them and their families. There are so many people, especially here in Santa Cruz, who don't have the option of staying home. Their work and their livelihoods means they have to go and work in produce. They have to go and work in areas where they can't call from home. I was talking to Dr. Phil and saying, I have all of these phone calls and all of these meetings. I haven't left my apartment other than to do takeout to support local restaurants because I'm trying to stay at home as much as possible and model the behavior that I'm asking other people to do. I'm lucky. I have that option. But for so many, they don't have the option of not going to work. So whether it's grocery store clerks or people in our produce industry, which is so important to Santa Cruz County, we have to do more as the general public so that they have a lower risk, so that that supply chain, so that we can still have our groceries. Because the worst thing that can happen is my inaction to help prevent the spread causes other people to get sick. I'm 30. I'm relatively healthy. Bigger guy, have a couple of health issues, but relatively healthy. I will probably be fine. My father, who's 72, who has pre-existing conditions like diabetes, has a chronic lung condition, he would not survive COVID-19. I haven't been able to go home and see him other than like waving from the yard, and we've had dinner for Father's Day where he was 12 feet away and I was on the other side wearing a mask, because that's the kind of behavior we need to be exhibiting, not for ourselves, but for the community at large. And I think that's one of the things where, as someone who is only 30, as someone who is in kind of that prime spot right now, where we're seeing infections growing mostly amongst young people, it's because a lot of my peers have said, I won't get sick, or if I do get sick, I'll probably be fine, and not taking the risk mitigation things that we need to do seriously. But it's not about hurting yourself when you are on the younger side. It's about the impact you're going to have on everybody around you. Your nanas, your tatas, your tios, your tias. And I think that's one of the things where, because we don't have that strategy statewide, and the most that we've been able to see in the last couple of days is we highly encourage you to wear a mask, but we're seeing the same people who are saying that not wearing masks. We need to be modeling the behavior that we're asking the public to do, because it's not say as I do, but then I'm going to go off and do other things. It's I'm going to try and follow the same things that I'm telling the people who I represent to do on a daily basis.
Right. And these strategies will help our economy. The bottom line, that's the way it is. So voy a hablar español. Hemos hablado de varias cositas. Primero, los recursos médicos son relativamente limitados. El representante Hernández mencionó que ciertos sistemas de hospitales están experimentando escasez de recursos, enfermeras, están trayendo enfermeras de otros lugares, porque estos pacientes son muy enfermos, requieren muchos recursos, es un nivel de tratamiento de alta complejidad y realmente el sistema está siendo utilizado a su máximo en Arizona. El número de camas de unidad intensivo están en los 80 y algo. Mencionamos que el Hospital de Niños de Texas está admitiendo adultos porque no hay capacidad en otros lugares. En fin, que nos concierne que el número de enfermos sea más que la capacidad que tenemos en el estado de Arizona. ¿Y cómo resolvemos esto? Utilizando las estrategias que hemos mencionado y vamos a mencionar en unos minutitos. Sabemos que esto es algo que nosotros tenemos que tomar el control. Nadie más lo puede hacer por nosotros. Es acerca de distancia, de usar la máscara, mascarilla, tapaboca y lavar las manos, mantener la distancia. Eso es lo que estamos hablando y el representante. Ahora nos vamos a mover un poquito a lo clínico. Y hay dos cositas que quisiera cubrir. Yo creo que, y el representante lo mencionó, pero lo quisiera explorar un poquito más, es el efecto de esta enfermedad en las familias. El efecto tan intenso. Yo tengo la oportunidad de hablar con muchos por varias razones, seguimiento, consulta, etcétera. Y es muy impresionante lo que estas familias pasan. Ansiedad, miedo, incertidumbre, problemas sociales, de trabajo, comida, víveres en su casa. El doctor Williams me ha ayudado también en todo esto. Doctor, ¿cuál es su experiencia cuando escucha, cuando habla con estos pacientes? ¿Qué experimentan esas familias? Sabemos que y no solamente es uno, porque si uno vive con la esposa, los hijos, puede haber la posibilidad que otros tengan la infección, afecta a toda la familia. Doctor, ¿qué nos puede decir del efecto físico y emocional en las familias con COVID-19 que hemos visto en Mariposa?
It's a great question. You know, we're blessed in our community here that we have a lot of times, a lot of generations living in one household. So for instance, even in my house, you know, I live with my mom, my wonderful mother-in-law, you know, my 3 kids, my wife and I. So we have lots of people kind of communed in one area. So one thing that we've seen is that because COVID-19 and SARS-CoV-2 is so contagious, we've seen a lot of times whenever one person is positive, it affects the entire family. So it's very common that if one of my patients comes in, it's also the mom and it's also the grandma who are also infected. Everyone knows that you know, the virus is highly contagious, but also has a high morbidity or has a high complication rate. You know, we've said this before, but roughly 14% of people are hospitalized. And people know that. You know, people have family members who have been hospitalized. So that by itself creates just a lot of fear. One, because we still don't exactly know, you know, what risk factors and what things specifically make some people get a lot sicker and other people don't. We know some, but we still don't know everything. So a lot of people are just really nervous, and a lot of people are scared. So I think that's one reason why you need clinics like us. That's one reason why doctors are so important. One, to answer questions. If you look online, there's a lot of misinformation. So it's please, you know, contact your physicians, and we can help to kind of dispel some of those. Anytime there's misinformation, there are, you know, a lot of actions that are taken that may not be in the best interest of your health. For instance, I was reading on Facebook that someone posted that you should wash your eyes with soap, and you should also swallow salt and soap solution. You know, there's all these things that have no basis in science that are really, really harmful, that can really affect you. So that's why, you know, please look to the guidance of your doctors. Look to what researchers and experts like Dr. Fauci saying. Go to the CDC website. Look at the Arizona Department of Health website. And, of course, contact your provider for any specific questions.
Right. Because we've had leaders who will repeat things that are not necessarily the most accurate. So we can't even trust our elected officials and leaders because we're not scientists for the most part. We're not physicians. Right. So I think I tell everybody, take everything that I say with a grain of salt, but we need to be looking at the scientists and the doctors to make sure that that's where we're getting our information. Pero en español, una de las cosas que quería decir es, todos tenemos que poner nuestra parte para asegurar que estemos tratando de prevenir y tratar de, como nosotros, como los jóvenes, no nomás estamos pensando sobre nuestra salud, pero todos los con que estamos en contacto, nuestras familias, cuando vas a la tienda y compras cosas en la tienda, cuando vas a la gasolinera para agarrar gas, cada interacción que tenemos nosotros como individuales y como jóvenes, piensa de todas las personas que tú estás afectando y todas las personas que ellos van a afectar. So, yo uso la mascarilla, la cubreboca, estoy usando el hand sanitizer, estoy tratando de mantener distancia, no estoy yendo con mis amigos y teniendo fiestas grandes. Puede ser que cada vez en cuando tenga cena con una persona y estamos en diferentes lados del apartamento, pero para la mayoría de los tiempos yo tengo que estar pensando sobre personas como mi papá, que tiene 71 años y que tiene problemas de diabetes, tiene problemas de los pulmones, y si yo me enfermo y yo voy y me acerco donde él está y yo, puede ser que yo me sienta bien porque soy asintomático o tengo muy mal, mild symptoms, ¿cómo se dice en español?
¿Síntomas leves?
Cosas leves como síntomas. Yo no me voy a sentir mal, pero lo que a mí no me hace sentir tan mal o no siento nada, puede matar a alguien como mi papá que tiene ya problemas de salud. Pero cuando yo estoy en la tienda y yo no estoy usando un cubreboca y estoy hablando con la cajera que tiene una mamá, un familiar que está débil, que tiene problemas de salud, ella no tiene la opción, él no tiene la opción de no venir a trabajar, porque si él no viene a trabajar, no les pagan, no pueden comprar comida, no pueden pagar por sus casas. Pero yo soy alguien que tiene mucha suerte, que la mayoría de mi trabajo yo lo puedo hacer en casa. Yo me puedo quedar en casa y es mi responsabilidad como alguien que tiene ese lujo, que yo cuando sí tengo que salir, haga lo máximo que yo puedo para proteger no nomás a mí, pero a la comunidad alrededor de mí.
Sí, qué bueno, muy bien dicho. Y es precisamente el propósito de esta transmisión, es enfatizar esas estrategias de prevención.
Sí.
Absolutamente. Y una de esas estrategias envuelve el uso de la mascarilla. Esto es un virus respiratorio.
Sí.
Se transmite a través de la respiración. Si enfatizamos la importancia de lavar las manos, mantenerlas limpias, evitar superficies. Eso es muy importante, pero la realidad es que este es un virus respiratorio. La importancia de las manos es para evitar que toquemos la boca, la nariz y los ojos, sí, donde el virus puede entrar en
los últimos 20 minutos ha habido como 4 veces donde me quiero tocar la cara, pero porque yo estoy tratando de modelar lo que yo quiero que personas hagan. No pienso que me han tocado la cara, pero es una de las cosas que es muy fácil como persona decir, oh, pues nomás me voy a tocar el ojo, o nomás me voy a tocar la nariz. Pero cuando tenemos un virus como COVID-19 que se pone por droplets y se te mete por la nariz, los ojos y la boca, cada cosita que hacemos puede ser una manera que se te meta adentro y que te puedas infectar.
Así es. Y precisamente la máscara o mascarilla se ha demostrado ayuda, precisamente porque tenemos menos tendencia a tocar la boca y la nariz porque tenemos la máscara.
Sí.
Y la ciencia es buena. Tenemos varios reportes de universidades que se han dedicado a investigar Y le voy a pedir al doctor William que repase un poquito esa, esa información que nos ayuda a promover el uso de mascarillas para protegernos uno al otro. Porque esta enfermedad realmente es una enfermedad de todos y de uno. Y si no hacemos algo, la infección va a continuar. Aquí no hay nadie que nos pueda ayudar más que nosotros. So, el doctor, ¿puede
Sure.
compartir la información de la ciencia?
Of course. You know, when you look at COVID-19, just like you mentioned, it's transmitted via respiratory droplets. The first thing to know is that it's very, very contagious. It's at least 2 times more as contagious as influenza. The incubation period is also 14 days. So that's a very long time that someone could potentially be contagious. You know, also, if you are a carrier, you can actually transmit the virus up to 48 hours before you have any symptoms.
Right.
Meaning you feel absolutely fine, and up to 2 days before having any symptoms at all, you can still transmit virus. So masks are, you know, super important. One of the most important things you can do for a couple reasons. You know, there's a study that came out of Washington that said that if 95% of Americans use masks while in public, we could prevent 33,000 deaths by October 1st. So I just want to repeat that. So if 95% of Americans wear a mask, it could prevent 33,000 deaths.
Right.
You know, another thing to consider is that, you know, wearing a mask, it can decrease your transmission rate by as much as 50%.
Right.
So, you know, mask, it's really 3 things, just like you mentioned. Mask, isolation, social distancing, and also washing your hands. By far the 3 most important things.
And one thing about the mask, even though we use them, it's really important to do the other things too. So
Right.
it's not just about masking alone.
Right.
It's about social distancing, hand washing, and all of that. So when we talk about masking as a strategy to prevent each other from becoming infected,
Right.
we must not forget that the other pieces are really
And,
important.
and it's also not just one person out of 100 in a room wearing a mask. It's about making sure that we are all trying to be as careful as possible, and as many of us are observing that. Because the studies that have shown that the masks are effective also show that they are more effective when both parties in an interaction are wearing a mask.
Absolutely.
So, mask all the time. Encourage your friends and your family. And also in public spaces, let's model the behavior. Right now, a lot of cities and counties have started requiring face masks to enter public spaces, but you'll still see that people will forget. You'll still see that sometimes people are a little hesitant because they don't like having things on their faces. I hate having things on my face all the time, but if we're going to be out and about, we need to be encouraging our friends, our family, and the people around us. And it's not about shaming people for not wearing a mask. I think one of the things that I see all the time that is really, really harmful is when we turn this into something where we're trying to stigmatize the people who are wearing masks or stigmatize the people that are not wearing masks. Right. A prevention strategy is not one where we demonize the people who are not doing the thing that we agree with. We need to make sure that we're modeling the behavior, we're encouraging people, and I think one of the things that kind of has stuck with me most is Senator Sinema, who has been a great ally and has been really helpful, said on a call that I was on her with a couple weeks ago, we have a lot of strategies for reviving a business and the economy. We don't know how to revive grandma after she's dead from COVID-19. And that's something that stuck with me because there are a lot of things we can do to prevent, but once someone is sick, once someone is in the ICU, we do not have super effective treatment strategies yet. And we may not for months to come. So until we have those strategies or a vaccine, it is incumbent upon all of us to make sure we're trying to reduce it so that we are not having people go into the ICUs with these very extreme cases.
Así es, y el representante habló de la importancia de la prevención para evitar que nuestros seres queridos se infecten. Podemos ayudar a la economía, sí. Podemos abrir los negocios, abrir nuestra vida hasta cierto punto. Pero cuando perdemos una vida, ya es muy tarde, ¿no? Y precisamente para eso estamos, para comunicar nuestras impresiones. Nosotros vemos el efecto de COVID en Mariposa. Vemos la angustia, la ansiedad, el efecto en familias ha sido... Y yo creo que quizás los que no han visto eso, quizás no tienen una impresión certera de lo que es esta enfermedad. Puede destruir familias no solamente físicamente, pero emocionalmente, absolutamente. So, yo creo que hemos cubierto varios tópicos de importancia. Yo creo que vamos a terminar enfatizando lo que llamamos las reglas, las recomendaciones, el playbook que están apoyadas por la ciencia. I think we're going to end shortly by reviewing one more time the recommendations, las reglas, the rules, the playbook of what we need to do. Santa Cruz County, clearly number of cases. We are here to request help from our community to get over this. We see the struggles of families who are becoming infected in terms of jobs, in terms of other kinds of issues. And we feel compelled to engage the community in this. No one else can do it. No one else can do it but us. And we do it on Fridays. I was telling Representative, we do it on Fridays. We want to prevent social gatherings. When I hear that 50, 60 people got together, how many times have you heard that? And then a few days later, you hear that 2 or 3 tested positive. So that's not what we want to see. So, so we're going to end with a few things. So I'm going to ask Dr. Williams to make a few final comments about that playbook. I'll do the same with Representative Hernandez. And then I think we'll end the transmission. I don't know if we'll have time for questions, but we'll see. Doctor, what are your final comments about this?
Sure. Just want to remind everyone that really it is very, very simple. The 3 most important things again that you can do. We've already mentioned them, but I just want to reiterate: mask, hand washing, social distancing. That's a way to make not only you safe, but also your family safe, and even the healthcare workers and the other people in our community safe.
And that protects not just patients, by the way. You mentioned it very well. It's about protecting our healthcare institutions, which are becoming overwhelmed, and the resources are limited. Representative, any final thoughts on this?
I think one of the things that we saw in Santa Cruz County, because it is a smaller community, is more rural, it's along the U.S.-Mexico border, was a false sense of security, because we were one of the last counties to have a positive case for COVID. So there were a lot of people who would talk to me and say, that's a problem in Phoenix, that's a problem in Tucson, it's a problem for the big cities, it's not a problem down here. And now what we've seen is that false sense of security kind of lulled a lot of people into thinking, well, it's not going to come down here, it's not going to be a problem. But now we're seeing it is a problem, but in a rural community, in a border community like this one, we need to make sure that we are being more stringent about things like our PPE, conserving that for physicians. So if you see someone who's selling N95 masks, don't rush out to try and buy them. What we need folks to do is make a face mask themselves. There are plenty of guides online. The CDC has guidelines of you being able to do it online. There are plenty of options. Just even a simple cloth mask can go a long way towards reducing the transmission of COVID-19. Washing your hands. And I think one of the big things is, I used to work in healthcare. I used to work in a cancer research lab, and I worked at a hospital. I know how to wash my hands because I did it all the time. But for the general public, washing for 2 or 3 seconds underneath cold water is not enough. You need to make sure that you are getting every piece, any place where you might touch your face with your hand, the back of your hand, your pinky, your thumb, like all of those are potential vectors for you infecting yourself or other people. So make sure that when you're washing your hands, that you're washing your entire hands for at least 30 seconds with hot water and with soap. The friction will help make sure that you take off whatever things you have on the surface of your hands. In lieu of that, hand sanitizer, but making sure the hand sanitizer you're using is actually a high enough alcohol percentage that it is actually going to be effective. There are a lot of different ways. If you check the CDC websites, it'll tell you here are the things that are effective, here are the things that are not effective. But I've seen people who are like, oh, I'm making my own. I'm using vodka and aloe vera. Not high enough alcohol percentage. It's not going to be doing what you think it's going to be doing. And then you're going to be false in believing that, oh, I'm just going to do all this, and then I'm going to just put some hand sanitizer and I'll be fine. and then it makes you be less cautious in what you're doing. So I think sometimes we fall into this trap of, if we do some of these things, we start letting up on some of the others. And what I'm having to remind folks across the district from South Tucson down to Nogales is, you can't take your foot off the pedal on this. We have to be consistent, and we have to do everything. It's not an either-or situation. And the last thing is, we at the state level need to be working more diligently to provide additional testing. But then once we've identified cases, figure out how to isolate those people, so that if you do live in a household where it's 4 generations, you're not going back home after you've found out that you're positive and potentially infecting your other family members. And then also, how do we communicate with those that you've been exposed to or exposed to the potential infection, so that they can come in and get tested, so that contact tracing. Because we've seen that in other places this has worked well. South Korea has done this really well, because they learned the lesson from SARS back in the mid-2000s, where you contact trace, you isolate, you test, and then you don't have to shut down the economy for months.
Right.
We didn't do that. So now we're having to play catch up. So that's why we all have to play our part in making sure we're reducing the spread overall.
Great. Muy buenos comentarios acerca de evitar lavar las manos apropiadamente, no solamente 2 o 3 segundos, por lo menos 20, 30 segundos. Son muy buenas recomendaciones. Muchas gracias. Tenemos varias preguntas en español e inglés. La primera pregunta es, si ya la persona tuvo la infección de COVID-19, si puede volver la infección. Muy interesante esa pregunta. Al principio hubieron varios reportes de quizás había reinfección. Entonces se ha demostrado que la prueba de PCR puede estar positiva por varias semanas, 4 o 6 semanas, y no hay virus vivo, live virus, presente después del día 8 o 9. Hasta hace 2 semanas, la última literatura que leí dice que no ha habido un caso documentado de reinfección. Pero esta ciencia está dinámica, puede cambiar cualquier momento. Sí. No ha habido casos documentados. Los primeros se supo que el PCR sale positivo por varias semanas. Por eso es que en general nos estamos moviendo un poquito fuera de repetir el PCR después de la infección. Estamos dependiendo de los síntomas para hacer decisiones de regresar a trabajar. Entonces, en este momento no hay evidencia sólida que lo podamos obtener, pero quizás la semana que viene puedo reportar algo distinto.
Diferente. Y una de las cosas también que tenemos que decirles a personas es que si has tomado el examen y salió positivo, no quiere decir que no tienes que estar siguiendo de hacer las cosas que hablamos en el playbook.
Así.
Todavía tienes que ponerte cubrebocas, lavarte las manos y cuando posible mantener distancia entre tú y las otras personas.
Así es. Eso es universal. Sí. Todo. La otra pregunta, al pasar la cuarentena COVID-19 positivo, ¿en cuánto tiempo te regresa el olfato? We don't know. At the moment, hemos sabido que pacientes pierden el olfato por semanas. Ha habido casos donde después de varias semanas empieza a regresar. En otros tiempos todavía continúa. Recuerda que esta enfermedad es nueva, por lo menos aquí en Estados Unidos. El primer caso se reportó en enero, quizás. Estamos ahora viendo otros casos de diciembre, pero recientemente en enero. Y algunos casos todavía tienen problemas con el olfato. Yo creo que vamos a seguir viendo qué sucede en los próximos meses. Lo mismo sucede con la prueba del anticuerpo.
Sí.
Parece ser que el anticuerpo en algunos pacientes desaparece después de varias semanas. Hay seguimiento a todos estos síntomas, no sabemos. Yo he sabido de pacientes que han tenido problemas con el olfato y ya han regresado. Muchas veces es reversible, pero no sabemos si en otros es irreversible. Doctor, ¿está de acuerdo conmigo? Ok, muy bien. And then the final question says, many people will not wear masks because they say it's controversial to your health due to carbon monoxide and fungus growth. So, my answer is there's no science to back that up. Mayo Clinic, of course, a trusted source, does not recommend masking typically in 2 or 3 groups of people. Number one, children under 2, we know that. 2, people who have chronic lung diseases in which low oxygen is an issue. We know that. It could be COPD, could be some other lung condition, pulmonary fibrosis. And then other institutions have said people with disabilities that are not able to remove the mask in case of a problem. There's no evidence that masks have proven to be harmful. Dr. Fauci has been asked this question before, and there has been no issues. I saw something the other day that was really interesting. It's kind of a score in a baseball game, and the outcome was death, unfortunately. Death due to coronavirus, 125,000 or 130, I'm not sure. Death to masking, 0. So the score is way on the coronavirus side. So no evidence of that. I think by far, at this moment, the benefit outweigh the risk at the moment. And we recommend everyone to wear a mask. If you don't, you could infect others, like Dr. Williams said, and represent it in the pre-symptomatic stage or the asymptomatic stage, and you don't know about it. And you may not get sick, but others will. You mentioned that. If you may have it
And not know.
and not know, but if you transmit it to your father, he may get sick and get really sick. So that's not what we want. So.
And the only other thing that I would add is disposable masks, because the person mentioned fear of fungal growth. Well, it's really hard for you to grow fungus if you're not re-wearing the same mask over and over again. And for cloth masks and homemade masks and washing them regularly at a high temperature with some kind of cleaning agent or detergent to make sure that they're not just, you left it in your car, you've worn it for 3 months, now let's try and see if it's... So those are ways to help yourself.
Perfect. So the cloth mask warrant the same precautions as our clothing.
Right.
It's about good washing and keep that. Absolutely.
You wouldn't wear a pair of underwear 12 times without washing them, hopefully.
Absolutely.
Don't do it with your face mask.
Absolutely. So I'm arranging my mask. I'm going to use a hand sanitizer in just a moment. I want to make sure my mouth and my nose are covered. We'll use a hand sanitizer. I think we covered a lot today. Talk about a little issue in public policy, statewide interventions, businesses, economy, the playbook, masking, what we do at Mariposa. I think we covered a lot today. I want to thank Representative Hernandez for coming down to Nogales and spending time to educate our community. I want to thank Dr. Williams for his comments, clinical comments. Well, so I want to thank Edgardo and Marco for the production. We appreciate your following us on Facebook Live. We love Nogales. I believe we're scheduled to come back week after next Friday with another session on COVID-19. We'll probably talk about testing at that time. We'd love to talk about testing. And we'll see you at the time. Thank you very much. Have a great weekend and stay home and no large gatherings. Bye-bye.